So we are going to trace dorsal column tract. This is also called as dorsal column medial lemniscule system. So let us first know what are the sensations that are being carried by these tract. So the sensations which will be carried by this dorsal column tract are the most, you can say, modern type of sensations as per to evolution. So what are those? They are mainly the tactile sensations. Tactile means the touch. Okay. So fine touch, they are going to say, they're going to convey the fine touch. Then they are going to convey the well-localized sensation of touch, vibration, 2-point discrimination. Then comes proprioception. Mind it is conscious proprioception. So proprioception from the proprioceptors, these, from the skin, from 2-point discrimination from the skin, proprioception from the joints, from the muscles. Then there is stereognosis. That is the ability to identify any object by simply touching it with the closed eyes. Okay. So these are my sensations which are going to be carried by the dorsal column tract. Now, what is the fiber type here? What is the type of fiber that is going to carry? It is myelinated fibers. So if you remember in one of the classes, we had gone and seen the classification of nerve fibers. So we have myelinated or heavily myelinated nerve fibers getting classified as A, alpha, beta, gamma, delta. So these were the A fibers. Less myelinated were the V fibers, and C was the unmyelinated nerve fibers. Okay. So these are my sensations or the modalities of sensations. So if you look at them, what are their receptors? Obviously for tactile and touch receptors, we have the cutaneous. For vibration, 2-point discrimination, we have the mechanoreceptors. The cutaneous mechanoreceptors, they are going to sense these sensations. Then coming to proprioceptions, it is the muscle spindles, Golgi tendon organs. Stereognosis, again, it is the touch receptors which are involved. So this will be the mechanoreceptors, the cutaneous mechanoreceptors. The conduction through the dorsal column is a fast conduction. So this is a fast conducting system. My dorsal column is a fast conducting system. Then who is my slow conducting system? Anterior lateral spinothalamic tract, which is going to carry the pain, temperature, and crude touch. Okay. So if I have to say you the difference, so anterior spinothalamic or anterior lateral spinothalamic tract, this is basically going to carry this type of sensations. Dorsal column, we have seen sensations like tactile sensations, 2-point discrimination, proprioception. They are going to carry those sensations. So the sensations carried by, if I look at the difference, what is the difference between the dorsal column tract and the anterior lateral tract? If I have to say, the first difference is the sensations. So what are the sensations being carried? Here, the sensations that are being carried by dorsal column tract are the more evolved ones, or you can say more modern sensations like 2-point discrimination, tactile localization, vibration, stereognosis, proprioception. If you come to anterior lateral spinothalamic tract, it is basically the primitive sensations like pain, temperature, okay, sexual sensations, itching. These all are primitive type of sensations which are being carried by anterior lateral spinothalamic tract. Then what is the other thing is conducting velocity. So is it a fast conducting? Yes, it is a fast conducting system. How about anterior lateral spinothalamic tract? It is a slow conducting system. Why it is fast conducting system? Because myelinated nerve fibers, A, alpha, beta, gamma, they are involved. How about here? Pain, they are being carried, slow pain is being carried by C fibers, which are unmyelinated nerve fibers. And the fast pain is being carried by A delta fibers. Okay. Then C fibers are carrying by temperature also. That is the difference. That is because of the fibers who are fast conducting fibers are carrying the dorsal column tract. So hence it is a fast conducting system. For anterior lateral spinothalamic tract, less myelinated or unmyelinated now fibers are involved. Hence, it is a slow conducting system. Okay. So these were the differences. Now we have to go for tracing. Always make a midline first. Okay. Along the midline, you have to take it from below, that is from the spinal cord level to the brainstem level, then to the cortex level. So the highest is my cortex level. So we are going to start from the spinal cord. So we are taking first a spinal cord. Okay. Then in here, we'll take one more spinal cord to show that we have the fibers coming from the upper limb. Very good. Then we will make here the brainstem. So the main components for brainstem is my medulla. So this is pyramid, pyramid, olive, olive. Okay, fine. Lower part of the medulla, it is linked with the cerebellum through inferior cerebellar peduncle. No problem, fine enough. Then we have the pons. Then we have the midbrain. So we have the midbrain areas. And then the thalamus. Okay, so we have the thalamus here, and at the topmost what we have is the cortex. So we'll go level by level. This is my spinal cord levels, then this is your lower medulla, then this is the pons, this is the midbrain, this is my thalamus. Good enough, fine. So now let me take another color here. Fine. So we have the receptors here. So the sensations which are being carried by the dorsal column tract are the tactile sensations. So we have the touch receptors. So we can have the pressure receptors as Pacinian corpuscles. We can have the Merkel's disc as my receptors. Okay, they can be the one which can be taking here. Or we can have the proprioceptors. So the proprioceptors, the one which will be present in the muscles. So we have the muscle spindles who are going to be my proprioceptors. So these all fibers are actually going to go through what? So I'm taking one of them, that is one of these fibers. So they are going to go through the dorsal root ganglion. This is the dorsal root ganglion. From the dorsal root ganglion, the fibers go into the dorsal column. Okay. So I am taking the fibers from the lower limb. Suppose I am into the sacral area, sacral and the lumbar area. Okay. So these fibers which come here, they don't give any second order neuron. This is your first order neuron that they give. Then what they do? They ascend up. Okay. They ascend up as Fasciculus Gracilis. So we remember that the Fasciculus Gracilis is what? It is the bundle of axons which is coming through the dorsal column tract. Okay, and they are bringing the fibers or sensations from the lower part of the limb. Okay, and suppose we are in the cervical area or the upper thorax area. From there also there are receptors, and then through the dorsal root ganglion, the fibers go into the dorsal column. And these fibers, again, they also ascend up. So now we have two fibers, two fasciculus, you can say two bundles of it. One is the Fasciculus Gracilis from the lower limb. Then we have Fasciculus Cuniatus, which is there in the coming from the upper limb. Very well, good enough. How about this now next? Now these fibers, they are going to ascend up and they are going to go to the medulla, and in the medulla they have two nuclei on each side. Okay, so if this is the midline, this is my, you can say if this is my kind of right side, if this is my left side, so on both the sides they are present. So these are the nuclei which is present in the medulla. So what are the two nuclei? These two nuclei are called as Nucleus Gracilis or gracili nucleus, and these two, the one which is present here, this one, and this one. They are called as Nucleus Cuniatus. So basically, if I have to draw here somewhere, I can draw it. If this is my medulla, I'm going to draw the nuclei. If these are the nucleus, okay, these two are forming the Fasciculus Gracilis nucleus, and these two are forming the Fasciculus Cuniatus. Okay. So these fibers, the Fasciculus Gracilis fibers, they are coming and they are giving the second order neurons here at the nuclei fasciculus. And the fibers coming from the Fasciculus Cuniatus, they are going to give the second order neuron in the Nucleus Cuniatus. Now, if this is my midline, what is happening? The fibers from these two nuclei on one side, that is from the right side, they are going to cross over, okay? They are going to cross over and they are going to ascend up as a bundle, right? Then fibers from here, they are going to cross over and they are going to make a bundle and they are going to ascend up. Now this bundle, which is ascending up to, where are they ascending? They are ascending up to pons and then later to midbrain. Now they will be called as the median lemniscal system, or they will be called as medial lemniscal fibers. Okay, so we'll take up the ink here back again. So we have the fibers which are coming from the cuneatus, and we have the fibers which are coming from the gracilis. Now the fibers from the cuneatus, they are going to give the second order to the nucleus cuneatus. Fibers from the Fasciculus Gracilis, they are going to give the second order neuron in the nucleus gracilis. Then what will happen? These fibers from the fasciculus and the cuneatus, they are going to cross over and now they are going to ascend up. They are going to ascend up here as a median lemniscal system. So now this crossed over fibers, they are called as arcuate fiber, internal arcuate fiber. They are going to form the internal arcuate fibers. Okay, got my point? So they are crossing at the lower level of the medulla, and now this crossing over, after the crossing over, they are going to ascend up as a medial lemniscal system. Okay, now these medial lemniscal system, it is going to ascend up through the pons, through the midbrain, and then they will go to the thalamus. And where do they go in the thalamus? They go to the nucleus, which is called as ventroposterior lateral nucleus of the thalamus. So these medial lemniscal fiber, they go and they give the third order neuron at which nuclei of thalamus? VPLN. VPLN means ventroposterior lateral nucleus of the thalamus. Okay, so this we can tell if we want to know how exactly it is. Let me draw here one thalamus for you. Let me see if I can draw a thalamus here. So if I take this as a thalamus, okay, this is your nose area. If this is the nose side, the thalamus, I can always look at this like a potato. So this is the anterior end of the thalamus. This is the posterior end of the thalamus. This is the medial side of the thalamus, and this is the lateral side of the thalamus. And here is what is called as intralaminar nucleus. This is actually a white matter band on which there are gray matter nuclei embedded. Okay. Now, if you look at the lateral side, in the lateral side, again, this will be the ventro anterior one. Then this is the ventro intermediate and the ventro lateral one. In the ventrolateral, it is posteriorly located and laterally located, and it's a ventral side. So we call this nuclei as ventroposterior lateral nucleus. Behind this ventroposterior lateral nucleus, there is a small nuclei which we called as ventroposterior median nucleus. Okay, so this ventroposterior lateral nucleus, this is the main nucleus of the thalamus where most of the somatic sensations, they come and they give their third order neurons. How about ventromedian nucleus, ventroposterior median nucleus? Here, sensations from the taste, they come and they give their third order neuron. So in case of dorsal column tract, are sensory fibers which are carrying the sensations of touch, vibration, and two-point discrimination, stereognosis, proprioceptions. All of them are going to ascend up as medial lemniscule system, and they are going to give the third order neuron at the nuclei of the thalamus, which is that nucleus, ventroposterior lateral nucleus, or VPLN. Now, what is happening the next? From the VPLN, from the ventroposterior nucleus, the fibers are going to go, they are going to go to the cortex. They are going to radiate to the cortex. Now, there is one thing that you have to note here. Let me, I hope this is clear, that from the VPLN, okay, let me take a laser and show you. So from the ventroposterior lateral nucleus, the fibers will go to the posterior limb. They're going to go to the posterior limb of the, what we call as the internal capsule, and then thereby radiate to the cortex. Now, this part, particularly from the thalamus, how the fibers are going to radiate, I'm going to show you in a new screen. But before that, let me just revise it, which is the first order, which is the second order. So the first order neuron, it is there in the dorsal root ganglion. The peripheral part of it is connected to the receptors. The central part of it goes into the dorsal column. This is the dorsal column. So it doesn't give the second order neuron here. Rather, it ascends up through the dorsal column. Especially to note here that the fibers from the lower limb, they pass as Fasciculus Gracilis, and they are joined by the fibers coming from the upper limb, laterally being placed along the line, and now they are called as Fasciculus Cuniatus. So Fasciculus Gracilis and Fasciculus Cuniatus, they form a bundle of axons which go and terminate, and they give the second order neuron at the nuclei. And what are these nuclei? Their respective nuclei, Nucleus Gracilis and Nucleus Cuniatus. At these nuclei, what is happening? The fibers from the one side of the nuclei, that is from the right side of the nuclei, they cross over as if they are hugging, you know, they go anteriorly, then medially. So it is like hugging of a pillar, so that they form an arc, and that is what is called as internal arcuate fibers. So these internal arcuate fibers, they are the cross fibers, and now they are ascending up through the brain stem. So they will cross the pons, then they'll cross the midbrain, and they will ascend up and go into the thalamus. In the thalamus, they go and give their third order neuron in the nuclei of thalamus. Which nuclei? Ventroposterior lateral nuclei of the thalamus. And from there, they actually go to the posterior limb of the internal capsule, and then they radiate into the cortex. Which area of the cortex? The somatosensory cortex, area number 312. Clear? Let me take another screen. Okay, this is what you have seen, right? What we have done, we are going to revise it again. But let me take a pen and show you here itself, as if it comes to the thalamus, if this is my thalamus, how is it going to go to the cortex? So let me take a midline. Okay, along the midline, we have the two thalamus. Okay, next to the thalamus is what is there? The lentiform nucleus. See this one. This is forming the lentiform nucleus. Okay, that's a part of the basal ganglia. In between the lentiform nucleus and the thalamus, in between the thalamus and the lentiform nucleus, is a place which is what we call as a, the compact white matter area. And this is what we call as the internal capsule. And the internal capsule is having the posterior limb. This is called as the posterior limb of internal capsule. And this is the anterior limb. Okay. So when my fibers were coming, they actually came and they went to the ventroposterior lateral nucleus of the thalamus. From here, the fibers, the third order fibers, the third order neurons, they arise and they go to the posterior limbs. They first go to the posterior limbs. And from the posterior limbs, they fan out to the sensory cortex area number 312. To be more specific, it is 3A, 3B, 1 and 2. Clear? So this is what I wanted to tell you to be little more elaborate. So let me revise it once again. Here, although it is little, so they have started A as the cortex here. So if you look at the flow of information in case of dorsal column tract, the first is the stimulus. Your stimulus can be any mechanical stimulus, or it can be a chemical stimulus, or it can be, a stretch or a pressure or a vibration. So that may be the stimuli here. It is received by the somatosensory receptor, which is meant for this stimulus. Then what happens? From the receptors, the impulses are going via the dorsal root ganglion. They form the first order neuron at the dorsal root ganglion. Okay. So the first order neuron from the dorsal root ganglion, which is forming, it goes into the spinal cord, ascends up via the dorsal column, goes to the medulla. The lower part of the medulla, there is to the nucleus cuniatus and the nucleus gracilis, where they keep the second order neuron. From there, they kind of cross over as internal arcuate fibers, and now they are ascending up to the thalamus as medial lemniscule system. In the thalamus, they go to which nuclei? Ventroposterior lateral nucleus. Okay. From the ventroposterior lateral nucleus, via the posterior limb of the internal capsule, they go to the somatosensory cortex, area number 3A, B, 1 and 2, present in the post-central gyrus. So this is the flow of information via the dorsal column tract.